When discussing treatment options for scoliosis, we look at traditional treatment options being typically of the observation, just watching and waiting and seeing what happens. And obviously, observation provides no results in actually reducing the curve, but it could just observe a curve. And if the curve isn't progressing to severe standards, typically they don't intervene anymore. Once curves progress, they can sometimes use a more significant approach like bracing or maybe physiotherapy or exercises to help manage the symptoms and kind of slow down progression. But again, the goals are not typically to reduce the scoliosis, they're just trying to slow down the progression. And unfortunately, if these curves were to progress into severe standards, meaning typically over 40 to 45 degrees, this is when they start considering spinal fusion. But normally this is only recommended when all other treatment options have been exhausted, or the curve is progressing rapidly to the point of severity where they're concerned about how fast the curve is going to continue to progression, so they're considered spinal fusion. Now, these are typically traditional approaches. Now, there are other types of approaches that could address the scoliosis more functionally to try to actually not just slow down progression, but actually to reduce the size of scoliosis on a structural level. But this requires a more comprehensive approach to managing and treating your scoliosis.